Hello friends, today we are going to discuss some important one-liners in pediatrics. First of all, what is the calorie value of drip milk? Then what we mean by drip milk? When the infant is taking the breast milk, then the milk that's secreted from the other breast is known as drip milk. Then what is the calorie value of that drip milk? Is it same? No. The calorie value of drip milk is 45 kilocalorie per 100 ml. As you know, human breast milk, the calorie value is 67 kilocalorie per 100 ml. It is divided into fore milk and hind milk. To add something, fore milk is rich in protein and sugar. It is satisfy the thirst. Hind milk is rich in fat. It is satisfy the hunger. Next question. A child can develop which form of anemia if it takes goat milk for years together? The answer is megaloblastic anemia because of folic acid deficiency. Similarly, next question, a child who takes cow's milk for months together or years together, which anemia the child may develop? The answer is iron deficiency anemia. Next, Kernicterus baby will develop which variety of CP? Suppose a newborn baby developed Kernicterus in the neonatal period. If at all the child is going to develop a form of CP or cerebral palsy, which form of cerebral palsy is common? Answer is chorioathetated CP. Next, a preterm baby can develop which variety of CP in long run? Preterm baby who was there admitted in NICU, stayed there for 1 month or 2 months like that. Then if at all it is going to develop a CP, then which variety of CP a preterm baby may develop? The answer is spastic diplegia. It is because of the periventricular leukomalacia that occurs because of the juvenile matrix hemorrhage that is very much common during the management of a preterm baby. Next question. What should be the value of MUAC or mid upper arm circumference to stop SAM or severe acute malnutrition? It's a very common question used to ask in exam. The answer is it is less than 11.5 centimeter. As we know, if it is more than 13.5, it is normal. If it is between 11.5 to 12.5, it is MAM or moderate acute malnutrition. If it is less than 11.5 centimeter, then it is called SAM. Then what are the WHO criteria for SAM? There are 4 criteria. Weight per length is less than 3 standard deviation as per age, visible severe wasting or presence of bipedal edema, or 4th criteria, MUAC or mid upper arm circumference less than 11.5 centimeter. Among these 4, one has to be there to say SAM or severe acute malnutrition. Next, name the syndrome. You can look at the baby and you can name this syndrome. There is upslanting of eyes, depressed nasal breeze, your protruded tongue, low set ear. All these from the look of the child, you can easily tell this is the Down syndrome. Down syndrome, as you know, the most common is your trisomy 21. Then the most common pathologic form is your meiotic non-disjunction. Others are mosaicism and translocation, but meiotic non-disjunction is the most common pathogenetic mechanism. The clinical feature wise, upslanting of eyes, epicanthic throat, your flat occiput, your protruded tongue, clinodactyly, brachydactyly, all these are there. Congenital heart disease, which is a deciding factor for the survival of the Down child, because if the form of heart disease will decide the longevity or the survival of the Down baby. The most common form of congenital heart disease that is seen in Down child is your endocardial cushion defect. Other features may be your duodenal atresia, or many things are there, your simian crease, many things are there, but we have to know something about Down syndrome, because every year they used to get one question from genetics and most commonly from Down syndrome. Next, which anemia is known as Cooley's anemia? The answer is thalassemia major. As you know, it is the hemolytic anemia, congenital hemolytic anemia. 2 forms are there. Your sickle cell, many forms are there. Most commonly, we are getting sickle cell anemia and thalassemia. Your thalassemia is known as Cooley's anemia. The other name is also Mediterranean anemia. It is the quantitative defect of the formation of alpha or beta chain. You can you can look at the face. It is the face is usually known as hemolytic facies or your chipmunk facies. Prominence of your maxillary prominence, your depressed nasal bridge, your frontal bossing, your malocclusion teeth, all these are common. Pallor with severe hepatosmegaly, massive hepatosmegaly with history of a repeated blood transfusion. This is the case of thalassemia major. The blood transfusion will be recurring after 4 to 6 months of age with the monthly transmission. Every monthly, the child will be requiring blood transfusion, and ultimately the child will die of anemia, heart failure, or because of iron overload. This is the thalassemia major. It is also known as your Cooley's anemia. Then what is Evans syndrome? Evans syndrome is your ITP plus autoimmune hemolytic anemia. The combination is known as Evans syndrome. Next question. Antenatal intake of lithium leads to which defect in a newborn baby? As you know, some drugs are teratogenic, so you have to be careful before prescribing any drugs to a pregnant lady. Then the examiner can ask, if the mother is taking lithium during the pregnancy, then which defect you suspect in a newborn baby? The answer is Epstein anomaly. Epstein anomaly is common in a newborn baby whose mother has taken lithium during pregnancy. Then to add some knowledge, if the mother is taking penicillamine, then the feature that we can suspect in a newborn baby is cutis laxa syndrome. Second, if a mother is taking high dose of a vitamin D during your pregnancy, then you can expect supravalvular type of aortic stenosis in the newborn baby. Suppose the mother is taking statins, then you can expect bacterial anomaly in the newborn baby. Suppose the mother is taking carbimazole, then the form which we expect in a newborn baby is aplasia cutis. Suppose the mother has taken misoprostol, then we can expect Mobius syndrome or equinovarus type of deformity in a newborn baby. Similarly, stilbestrone, if the mother is taking, then vaginal adenocarcinoma is expected in the adolescent girl. These are the things which most commonly they used to ask. We have to know lithium, we can get Epstein anomaly. Penicillamine, we can get cutis laxa syndrome. Vitamin D, supravalvular aortic stenosis. Statins, it is associated with the bacterial anomaly. Carbimazole, it is associated with aplasia cutis. Misoprostol, Mobius syndrome and equinovarus deformity. Similarly, stilbestrone, you can get vaginal adenocarcinoma. These are the things we have to remember. Thank you.